frequently asked questions about intrauterine contraceptive devices. What are the different types of IUD, or intrauterine devices? They are the copper-containing IUD and levonorgestrel-releasing IUD. How effective are IUDs? If you use an IUD correctly, your chance of getting pregnant is less than 1%. What are the general contraindications to IUDs? The general contraindications are pregnancy, presence of STD, cancer of cervix or uterus, and unexplained vaginal bleeding. What are the specific contraindications to IUDs? You can't use the copper IUD if you have an allergy to copper or have Wilson's disease. Hormonal IUDs are considered safe unless you have liver disease, breast cancer, or are at a high risk for breast cancer. In rare cases, the size or shape of your uterus may make it tough to place an IUD. How long do IUDs last? Levonorgestrel-releasing IUDs last 3 to 5 years. Copper-containing IUD last 10 years. What are the complications of IUD? They are unscheduled spotting or light bleeding or heavy or prolonged menstrual bleeding, amenorrhea or oligomenorrhea, especially during the first 3 to 6 months of use. These bleeding irregularities are generally not harmful. If pregnancy happens, it raises your risk for miscarriage, infection, and early labor and delivery. An IUD slightly raises your odds for pelvic inflammatory disease. It's rare, but an IUD can poke through the wall of your uterus as your doctor puts it in. What is the risk of ectopic pregnancy in IUD? Current IUD use does not increase the risk of the ectopic pregnancy. However, a pregnancy with an IUD in situ is more often an ectopic one than a pregnancy with no IUD. Past IUD use could mildly elevate the risk of ectopic pregnancy. When can the IUD be inserted? The copper-containing or levonorgestrel-releasing IUD can be inserted at any time if it is reasonably certain that the woman is not pregnant. The copper-containing IUD also can be inserted within 5 days of the first act of unprotected sexual intercourse as an emergency contraceptive. If the day of ovulation can be estimated, the copper-containing also can be inserted more than 5 days after sexual intercourse as long as insertion does not occur more than 5 days after ovulation. Is there a need for backup contraception? No additional contraceptive protection is needed after copper-containing IUD insertion. If the levonorgestrel-releasing IUD is inserted within the first 7 days since menstrual bleeding started, no additional contraceptive protection is needed. If the levonorgestrel-releasing IUD is inserted more than 7 days since menstrual bleeding started, the woman needs to abstain from sexual intercourse or use additional contraceptive protection for the next 7 days. What evaluation is needed prior to IUD insertion? They are blood pressure, weight, height and BMI, clinical breast examination, bimanual examination and cervical inspection, laboratory tests for glucose, lipids, liver enzymes, hemoglobin, thrombogenic mutations, cervical cytology, STD screening with laboratory tests, HIV screening. What is the management if the user develops PID? Treatment outcomes do not generally differ between women with PID who retain the IUD and those who have the IUD removed. The IUD does not need to be removed immediately if the woman needs ongoing contraception. If the woman wants to discontinue use, remove the IUD sometime after antibiotics have been started to avoid the potential risk for bacterial spread resulting from the removal procedure. What is the management if the user is found to be pregnant? Evaluate for possible ectopic pregnancy. Advise the woman that she has an increased risk for spontaneous abortion and for preterm delivery if the IUD is left in place. The removal of the IUD reduces these risks but might not decrease the risk to the baseline level of a pregnancy without an IUD. What is the management for missing IUD strings? Missing IUD strings may be a sign that the IUD has been expelled or has perforated the uterus. Determine her risk of pregnancy by asking the woman when she last felt the strings and if she has had unprotected intercourse since that time. Next, perform a pelvic exam to determine if the strings are high in the cervix or hidden by a fold in the vagina. An ultrasound or X-ray can be used to locate the IUD if the strings cannot be found. If there is a risk that the woman is pregnant, however, an X-ray should not be used. The client should be provided another contraceptive method to use until her next menses. If the strings have retracted into the uterus, they may fall back into place during menstruation. Tell the client to check for strings after her next menses. If the strings are still not present after the next menstrual period, the client should see a physician for further examination. If pregnancy and a perforated uterus are ruled out and the IUD has been expelled, another IUD can be inserted immediately. If the IUD has perforated the uterus, refer the client to a hospital for treatment.
Audio Jungle. Audio Jungle.